Good afternoon. This is the House Appropriations Committee. It is Wednesday, January 14th, 2026. It's 2:45 in the afternoon. We have just finished the one public hearing that we have for the Budget Adjustment Act. And so my thought was that we could spend a few minutes sort of debriefing what we heard, making sure we have the right numbers, seeing if we all agree and missing. We're not going to make any decisions on it. It's just kind of an acknowledgement and debrief about any questions. James is putting together a spreadsheet for us of what the asks are. And so he'll separately put things like what people support something that's already in the governor's proposed budget. So that's separate. Then we have some amount of new asks. And in some cases, I'm not sure they actually said the amount, or, we have to do some looking. So we'll talk about all of that. And just to give you a sense of the timeline, the real timeline that we're going to do now for the budget adjustment. We still have some more things to learn. We have the revenue forecast on Friday. We have the governor's budget speech on Tuesday. So we need, and usually what happens after the governor's speech, you may recall last year, they came in and said, could you move some of the stuff from section C into budget adjustment? And maybe there's some other things that we move out. So there'll be all of that. So my goal is that by next Friday, the 23rd, we will do a straw poll on the budget adjustment. JFO will work over the weekend and do the rest of their spreadsheets. We'll start to get some of their spreadsheets next week or maybe later this week at any rate. And then we'll do the final vote on that Monday of the budget adjustment. And so then it will be on the floor on the 29th and 30th, that Thursday, Friday, and then it'll go over to the Senate. And unless one of you wants to take the lead and do the whole floor report, I'll do the floor report and you'll all be ready for the questions. Does that all make sense? Yeah. Okay. If I have a volunteer, if you want to volunteer, you just let me know. Okay. So.
You'll be great.
So questions, comments, thoughts? What did you hear when we were chatting with people? Dave?
Well, just clarification. Are we going to get something from Teresa Wood's committee?
Yes, she's coming in tomorrow.
Thank you.
Yes. And we'll also get something from healthcare. I don't know that Alyssa's actually coming in to testify. We may just get a letter from. And then we also have a treasurer and teacher pension thing. And that's somebody's coming in from the treasurer's office tomorrow to talk about that. So that's another sort of budget adjustment thing we have to do.
I'm sorry.
I saw Mike and then I hear Tom. Okay.
Thanks. When we get the spreadsheet, will it include the bottom line with the current BAA? And if there is available funding to put towards somebody? For instance, last year we had an amount that we came up with.
Well, we did for the budget itself.
So
For budget adjustment, we had a little bit of money for something, but it wasn't a lot.
Right.
So yes, there is, we're talking about possibly Section 8 housing. We're going to talk about the treasurers. We have some little pots of money where we can use some things. And I think, I'm not sure what sort of spreadsheets we're going to get from Emily and James about money.
It should look very similar to last year. I'd say,
Okay.
to the extent, once we take into account the revenue forecast, changes, big bill, et cetera. Other things you want to change, there should be a number left over.
Well, because we still have money that we gave 50 million to the e-board.
Right.
And we have the 30 million and
30 million bucks.
We're not going to spend it all in the budget adjustment. There's too much unknown. But there are some things that we're finding that we may have to do something. So I don't have a number for you. I don't have a magic number this year at the moment. Wayne and Tom.
Or Tom first. Land access opportunity board.
Mm-hmm.
They're all asking here, and then when they're asking for 10 positions in the BAA for $1.9 million.
I don't think they're asking for 10
10
positions.
positions in the BAA.
No, it's
It's a $1 million.
it was reverted and then in July. And then it was put into the BAA.
Yeah, it was,
It was in the budget for FY 27.
But no.
And it
money.
was, no, we put money in for FY 20, sorry, I'm 26.
The
We
government's
put,
recommend.
we put money in, it was in the budget for FY 26. And they reverted some of it, which they weren't supposed to do. They
well,
had to unrevert it, right?
no, it was kind of a carry forward. It was confusing. It was kind of a carry forward that we approved, everybody, no one noticed that there was something wrong with it. It was money that they hadn't yet spent on programs. And the way that it was written in the budget, the administration came back and said, no, that's not the way it goes. That's not the way we do our business here. And so they got an agreement from the administration to put it back into the BAA, so they had access to it, kind of clearing out whatever difficulties we had with the budgeting last summer.
Right.
So that they can put into these programs. I can't speak to your question about the position, but this was money that we all approved and was signed into law as a continuation. And it was only later that the technical of it. So the administration is quote unquote giving it back to them. They're just doing it in a different way.
There are 10 positions mentioned here. I recall someplace in here, it's 10 positions.
I don't think so. I think it's related, so it was money that was used in grants to communities, and there was a reason why they were rolling that forward, because the grant program wasn't going to become operational until this fall. And so at any rate, they really don't have, there's
Nothing that says in here about 10 positions.
no, but in the document they gave us,
Right.
it mentioned, I mean, I agree, it had been appropriated and it got taken back and now they're asking back again. But I think what you're questioning is.
Someplace it's 10 positions someplace there, and they didn't give us any description of what those positions were.
I don't think we're funding any 10 positions. If you read what the governor has in his spreadsheet.
They wanted 1.9 million.
This is $1 million. It's just $1 million that they took away, that the administration took away, which they shouldn't have, and now they're putting it back.
Okay.
That's all this is.
I want to get clear on that, because when I started looking at it, what they told us they were going to be doing is training up, developers, and these folks here don't have any
This is to
experience.
provide the resources needed for the Homes for All Phase 2 in the Secure House Coaching Program. So this is exactly the same stuff that the people who were saying support the governor's recommend we're talking about. So I think
It's your budget, Tom, right? So.
Okay. I'd like to know more about it, because I don't have a positive feeling about it at this point.
That's fine. If we have copies of the information, they should be from, they were here in December, so
Right.
it should be in our website for what how they explained it. But I'm pretty confident that they weren't asking for 10 positions within LAOB. And I'm guessing here, so I don't want to be held to a truthiness standard of just saying that it may be supporting 10 positions or maybe supporting other positions in the work that they're doing without it being direct employees of the state.
it also may be like their hopes and dreams for the future. I mean, we may have, I don't remember. So I would go back and look at the documentation. They came in.
In between now and whenever we're taking the 23rd, we'll get a clarification on it.
Yeah, they
I don't
came in
know
on
if
the
it's possible.
16th.
If we had to, we could ask them to come back and explain.
Yeah.
When I looked into it, I spent a little time looking into it, and I'm concerned that they're going to be providing a function that's going to be useful. Because developers usually there's a lot to develop. You got to know architecture, you got to know real estate, you got to know.
They're not doing that. They're giving grants. They're not doing that stuff.
But yes, we can get the clarification or.
I'm looking quickly at their.
It's
their
reappropriating what you had already done last
Yeah.
year.
Right,
So the
exactly.
question- if you have a question about what they're doing,
You gotta look
that should
back
have been
to
raised
year.
last year. We're just sending out the same money.
Right. And you take a look, you guys think, I'm not seeing anything about any 10 positions anywhere.
I'll look.
So I'm not sure where that's going. So let's move on to other things. So that was,
Just,
Yeah.
yeah, and just, so on the, Donna's stuff about the legislative council. So just know that, I mean, that'll, if that goes into the BAA as language, there's no money attached to it in the budget.
That's
So
right.
And I'll meet with Scott Moore after the budget's announced, but maybe before the 23rd. So we have a clear understanding of what, because it sounds like it's a pretty lateral merger in terms of people.
it's
They're not
just
adding
dividing the
people.
people up that were in legislative operations into either going to JFO or to.
Yeah, it's a reorganization
Right,
exercise.
and in fact, they've been doing that for the last 9 months, since Mike Front left. So we're sort of codifying what's been.
Yeah, but it is right that they were this back and forth. I mean, there was a thing between legislative council and JFO and the discussion of merger or just, yeah, before, and, or maybe after Luke Martin left or something like that. It's how they could go. Figured out.
Yeah. So that should be all right. Any other comments from what we heard today from folks?
I think just one for me, one of the last ones, funding not provided as allocated, the 2% increase, any
Areas on aging,
We have case management.
case management.
Right.
So something wasn't, like, given a percentage was not provided.
right? So we don't know,
We don't know what that
we
is.
don't know what the dollar amount is, and it sounded like 3 of the 4 quarters, they said just general fund, and the other 4th general global commitment. I don't understand that.
Right, that was what I was-
And then, but they were supposed to be part of the 2% Medicaid rate increase.
Right.
Dave, is this yours? Dale?
Yes.
And so maybe a chat with Nolan or something about
Get
it.
the cost.
Well, and also why they didn't get it.
Yeah, that's the
I
part
think
don't-
they got it, but it didn't cover their administrative.
Oversight, I don't know.
Or I think what I heard also, or in addition to that, I heard that some services got the bump up and others were actually decreased.
That was the
It was
HSBC.
the ERC residential. That was the Catholic Charities.
Yes,
I was talking about that one.
right.
Right, that's.
Yeah.
And I think we're gonna get something from Human Services Committee on that.
Probably.
They've taken testimony on it. They're saying the department reallocated some of the enhanced residential care funding amongst 3 tiers, eliminated 1 tier, took that money and put it into tier 2 and 3.
Right.
And it's the Alzheimer's folks have indicated it's making it very difficult for people with beginning Alzheimer's to get into residential care because there's no corresponding reimbursement for them,
Right.
creating some real hardship.
Yeah.
But because the money's already been spent, it's up. You know, they don't want to reduce the tier 2 and 3 and take it back from them and give it to the 1. How much of an up, I don't know, but I think Human Services does. I don't know if it's bigger than a bread box or not. And then the other one, the lady, I don't know if you caught it, she's very eloquent. She mentioned my name.
Yes.
Oh, yes.
Funny there.
She did, I wrote that down.
Yeah.
Your cousin, Dave, yeah.
Yes.
That's why I'm asking.
That was the 2% cost of living that was omitted from them. They can't get, with the new changes in Washington on Medicaid, they used to be able to go back and bill
Right.
retroactively for up to 6 months. They can't do that anymore. So if people wanted to use Medicaid, you could do it for April, May, and June. And they're saying, please do that make up the back months from March to July,
Yes.
which your general fund. And I don't know I guess we should ask Nolan if he can calculate that.
Right.
If people are so inclined to, yeah.
Well, we should know what the number is regardless of whether we're inclined. We should get that
Yeah.
information. So I don't know if you guys can ask Nolan to figure that out. I was also really surprised that with the recovery centers,
Right.
they were very clear on how to distribute the money because they figured it out, what they all needed. And then whoever it was didn't even do it.
That's what I want to know, is why was it not distributed the way
Right.
Right?
they asked, or I don't know what this committee says.
I don't know. Is that yours?
Of course. But, you know, it was,
But it was, they put in what they needed
Yeah.
by, yeah. so
right, and
that
it
kind
was,
of would
it's
make
all
somebody
backed up with, you know, their testimony, et cetera, in terms of the intentions, and,
Right.
The state did it differently.
They did.
Yeah.
Who does
Sounds
that? Where does that come from?
Health
well,
department?
yeah, health department, I think.
So
So
we
I'll
need to
take
dig
it.
into that.
Okay.
That
I
just
will.
seems, that seems like a.
Well, I looked at that one and they said they needed 420,000 because there were 6 who needed,
Right.
did not get the money, and that should only come to 300,000.
No, it wasn't supposed to be 50 each one. The 12 recovery centers said, here's what we need for each one, and it was gonna add up to the 800,000.
Right.
And so some needed more and some needed less. So some people didn't need 50,000 and they got it. I mean, they just did this,
Yeah.
it's like they didn't even talk to them.
Actually stated
And
that.
so on that, divided the,
No, they just did it the way they wanted to. They didn't listen to what the recovery centers said they needed.
anyway, they came up with a shortfall.
Yeah.
Well, a shortfall from what they thought, but not a shortfall from the total amount that you appropriated.
Right, so they didn't give it to everybody. There were 6 that didn't.
Not everybody got the amount they thought they were gonna get. You know, it's things that, I mean, I never know, well, where is language needed, right? Because sometimes we don't want to name each organization and the, but it seems like maybe we need to get more specific.
Yes. Well, and every
You know.
year we say this, and every year we think we've got more, and then something
Maybe
like
we're
this
just getting
happens.
better and better though. I don't know. Well, it's the same problem we ran into with the adult education.
Yes,
Still
still.
last year. And
Yes, it's still
now there's a report on maybe
Right.
going to do it, but they don't agree.
Well,
But
yes.
somebody should have got considerably more money than what they asked for, or what they needed.
Right. And some people got more than what they needed. And so that doesn't make any sense.
They're
at all.
not volunteering to give it back.
Well, you know,
Did that.
they're all, you know, how we overfund all these things. So that was something. And then, I guess we'll hear from Teresa, but the Hawk thing, that was sort of a surprise that we needed, you know, I don't know where that's coming from. I was aware that Bridges for Health was gonna come. That we probably needed to do that. 'cause we
The
had-
total cost, I mean, is, because because H91 didn't go through, then the appropriation that was in H91
For Bridges
was,
to Health.
yeah, for Bridges to Health was actually picked up by Nuveen, correct? And then, yes.
Okay, yes.
Our audience in there is nodding. And then, so then, and what they seem to be talking about is a, kind of the cost associated with finding a new home and kind of transferring to that home in terms of records, in terms of administrative capacity in the early months in July, because oftentimes organizations have to wait for funding for several months. At any rate, that's how I understand that 167K. That's not the cost of the whole program.
No, it isn't, because I think it was 565 or something like that. But it sounds like it's transitioning to the free and reduced clinics,
Yes, that is.
which makes sense, where it should go. I think Mike Fisher said that when he was here, so instead of UVM taking it on, it would go where it's needed. But it really, it does help our migrant workers that are dairy farms and things like that. So it's kind of an important thing. Not that much money. Other comments, thoughts?
I had one.
Yes, Dave.
Tiff, if you don't mind, it's in your area. I wondered,
Have thoughts in anybody's area?
I wondered if I
We
could.
all have thoughts about my areas.
I didn't know if we could ask Joint Fiscal to help us on this, but Michelle Fay from Voices for Vermont Children caught my attention on the reach up when she indicated, the reach up block grant is $47 million. They spent 36. And she said, instead of the money staying with reach up, she mentioned 6,000 children, 50% of the poverty level, it's poorest of the poor. The money's been leaving the program. When DCF came in and testified on the BAA, I mentioned that. I said, gee, you're booking 3 million to the bottom line. Could you have used it on reach up? They didn't really answer. When Michelle spoke, I may have read much more into this than she said. I almost thought that the law said it should stay in reach up. I don't know if anybody else caught that.
I did.
Yeah.
She
Yeah.
mentioned it was a statute
The
purpose.
statute,
that.
I thought if JFO could help us,
They might-
it's an accounting thing.
I'll ask.
Do you know,
I
Tim?
wrote that.
No, not off the top of my head, but I will ask JFO to clarify that for us, yeah.
The question I had was regarding the Vermont Food Bank. You're asking for 1.5. It sounds like they got 500 last year. So did they ask for 2 and you only appropriated?
I think they asked for more than that. I think they asked for 5 million or 3
There
million
have
or,
been times they've asked for.
Yeah.
Right,
So,
okay.
is that an A?
What?
Vermonters feeding Vermonters.
I think it is,
Yeah,
Yeah.
I think it is.
it's the farm.
They have several,
Yeah.
I mean, I can look back, they have several programs that are in their account, in their portfolio of managing.
Yeah.
But we can, I'll check in.
Yeah.
I know that last year, all of our working lands, Vermont, street Vermonters, we shorted their asks.
Yes.
All of those programs got shorted.
I know what you mean. Yeah,
And if I'm remembering correctly, this fall,
you never know.
the food bank got,
Yes.
it was a 250K.
Yes, we gave them
SNAP
2 from the
prices,
SNAP, we
so
gave them
that
250. Right, that was just so that they could get just people fed because
Yeah.
it's gonna take a week to get SNAP up and running. So that was a quick, short-term thing. So I think, looking into that a little bit would be good, because I know that the federal government also wasn't that, that was one of the first grants that was taken away, was something in Agency of Ag. It wasn't the same program, but it was a thing that was taken away for like 1.7 million.
Well, we'll have to track it down. I mean, I know that Vermonters feeding Vermonters got shorted.
Right.
Got like 25% of what they
Right.
asked.
The other thing I didn't hear a number was, by state primary care, the FQHCs, about a rate adjustment. And I have no idea how much that's supposed to be, James, or somebody else. They just talked about it. Yeah, last year we had exact numbers, $4,315.
20 cents.
Yeah,
It's supposed to be an inflation adjustment.
right, and I don't know what that is and the percentage or the dollar amount, so that would be good to find out. Who has FQHCs?
Not,
I think I did.
Okay.
Somebody else wants it?
No, I'm doing the floor report, this one's yours.
But I almost thought,
Yeah,
we put money in the budget, almost 3 million
At least some-
for the FQ. I almost thought to myself, I said, gee, is she talking about FY 27
right,
as opposed to BAA?
Right.
Because we did give them money, BAA, right?
Yeah, we did. We gave them a
Yeah.
subsidy,
Right.
$500. They were short and we,
right.
Last year.
So would you just check into that, Dave?
Sure.
Okay,
Other when we had this Tri-Valley Transit, he said he had an $800,000 deficit. And I think he'll take whatever support we could offer him. I think that was the, but he
Yeah.
didn't come.
Then
with a
it sounds like he's
specific amount.
expanding into Washington County.
well, there, yeah, so Jim used to be just Addison County, so actor, Addison County Transit Resources, so I've known them since those days, and they've since, they've asked me to take over all these other ones. And, but I think there was also a contract, there was, he wrote me in December, because he couldn't get in during our December time to talk about this. They were still waiting on the contracts too, at one point from
them.
AHS, like 5 months in, they still didn't have a contract from the budget. So this seems to be an ongoing issue too about contracts getting, executed and so people can do the work.
That be related to the federal money being on and off and on and off and.
Well, not this particular, this is money that we gave them in the budget, not any federal money.
We shouldn't have to do anything.
Right.
We should have it.
So we can, that might be, is that transportation? I don't know what that is.
I don't know. I can look into it.
Yeah, I'll find your email I got from him about
Medical
that.
it's non-emergency medical
No, it's
transportation.
not emergency medical transport, so all of them are required, as he said, it's an entitlement, so they're required to take people to their, Medicare patients to their appointments.
I just wrote that it's for non-emergency medical.
Yes, that is what it's called, and they're required by law to take people.
Way back when they first started this stuff, there was a guy who was at one of our legislative breakfasts who complained all the time about the fact that, and I think this may be related to his medical appointments and your, go to the hospital and he was always complaining because they wouldn't pick you up. They only had so many per month or per week, and it was reserved for your medical, necessary,
Right,
like healthcare related things, because it's paid for by Medicaid.
right,
And he was complaining about the fact that he couldn't take us to go to the American Legion on the social event that he wanted to go to, which is a whole other issue, but because it was limited to only so much per week or per month,
yeah.
that may be part of this. If they spent more for people, you can go to three doctors in 1 week without, if you've got continuing care, ongoing care things. I'm just wondering if that's part of it.
Sativa. Sativa.
I do.
All right, Dave.
This is getting a little disproportionate.
Well, yeah, I don't know.
Just teasing.
Okay,
Some of us like that.
Yeah.
we can share the work.
No, I'm.
All right, I'll share with you, Dave, I'll share with you, Jim's email explaining some of this stuff,
Okay.
okay? And so I'm thinking that since there was no floor, virtually no floor, just announcements, I don't know if anybody's listening, but we should probably, have they started the conference of the whole?
No, we're still.
They are.
It's late, I'll let you know in the calls.
Okay, that would be great.
Oh, never mind, I'm sorry.
Okay, so we'll need to go up, so, assuming, Tom, you know about this stuff better than I, you think this will go till 4 or something like that?
I hope it's only till 4, but it's not this is just an explanation of the process as far as I know, it's not meeting brief the candidates, that'll be a different vote for the election.
Right, although I think they're wandering around here today, but.
Yeah, because there's a
Yeah, they are.
reception at the contractor.
Okay, all right,
But they're, it depends on how long the legislative council has a slide deck that's pretty thorough in
Yeah.
terms of the history and the history of the process. I'm not speaking on anything related to this
Yeah.
today, so.
Right.
Half an hour, 45 minutes, I would say.
Okay.
I hope it wouldn't be.
okay, all right, so then I think I'll call it for the day, we're gonna start doing markup at 9:30 tomorrow morning. We'll start with the spreadsheet, We'll do what we've done in the past, which is we'll go through and if we're not ready for something, and I think there's a lot we may not be ready for, but we'll get a sense of what still needs to be done. And if we can check things off, the more we can check off, the better. But if we're not ready, we'll just, do it research on it. Yes.
Well, House General is taking the testimony on.
Right.
Vouchers tomorrow morning, so
So you may not.
I
be here
may
someday.
not be here for some.
Yes.